Nursing calculations, converting flow rates between mils per hour and drops per minute. Flow rate keeps a measure of how much liquid is flowing by for each unit of time. We need to know an amount of liquid, be it in mils or drops, and the time unit it takes to flow, be it hours or minutes. Mils per hour and drops per minute are the units that you will commonly work with. They can express the same amount, and you can and should be able to convert between them. The strength of expressing your flow rate in mils per hour is that you get a clearer idea of how much liquid volume is being added to the patient system. The beauty of having flow rate in drops per minute is that you can more easily calibrate how much medication is going in and how quickly. And also you can judge that visually by counting and timing the drops. If you want to convert flow rate in mils per hour to flow rate in drops per minute, you will need a couple of conversion factors to do this. Firstly, we want to turn mils into drops, and we know that there are 20 drops per mil. We want to get rid of the mils, so we should put that at the bottom, and the drops value can go to the top. We also want to turn the hours into minutes. 1 hour equals 60 minutes. So we will put the hour on the top so we can cancel it, and the minutes that we want can go on the denominator of our conversion factor. So we notice that after the cancelling, we have multiplied the numerator by 20 and the denominator by 60. Let's merge those together, and 20 over 60 simplifies down to 1/3. So if you have a flow rate in mils per hour and you multiply it by 1/3, you will get a flow rate in drops per minute. And that's the case for whatever the original flow rate may be. But remember, that is only true when 20 drops is equivalent to 1 mil. And that is when it is an IV for an adult-sized patient. So from this we know that flow rate in mils per hour can be converted to drops per minute by multiplying the value by 1/3. If you want to go from drops per minute back to mils per hour, you do the opposite, which is to divide by 1/3, but that is effectively the same as multiplying by 3. But remember, this is only true for macrodrops, which are the drops used for adult infusions. Let's recall our understanding of macrodrops and microdrops. Macrodrops for adult infusions are of a size such that there are 20 drops per mil. For pediatric infusions, on the other hand, drops are much smaller. There are 60 drops making up that 1 mil, and the drop factor is 60 drops per mil. So if we are dealing with microdrops and we want to turn flow rate into mils per hour into microdrops per minute, we can follow the same sort of calculation we did before. But we do not use 20 drops per mil, we use 60 drops per mil. The difference is, though, this time we are multiplying the numerator by 60 drops and the denominator by 60 minutes. Once again, we can merge them together, and 60 on 60 is 1. For microdrops, if you want to go from mils per hour to drops per minute, you multiply by 1. Same to reverse the process. What this is saying is when using microdrops for pediatric IVs, the flow rate value in mils per hour is numerically the same as the flow rate value in drops per minute. In summary, when you are using macrodrops for adults, turning your flow rate in drops per minute to mils per hour means multiplying by 3. Turning your flow rate in mils per hour to drops per minute means multiplying by 1/3. You may in some texts come across a formula that may look like this. This is just saying the same thing. Flow rate in drops per minute is achieved if you have flow rate in mils per hour and multiply it by 1/3. The mils over the hour here represents a flow rate because that is the formula for flow rate. Flow rate equals volume divided by time. When you are using microdrops for pediatrics, the conversion is simpler. Flow rate in mils per hour is the flow rate in drops per minute. You have now completed the final chapter. We hope you've enjoyed our series on nursing calculations.